I suffered from inflammatory bowel disease and IBD, ulcerative colitis and Crohn's disease. And when that happened to me 30 years ago, it really wasn't well known at all. And today it's become much more common. Uh, and it's a terrible thing that people that don't know. But what do you do or recommend? Do you have talk about it in a book, or what would you recommend to somebody if they've been diagnosed? Because it's often misdiagnosed, but diagnosed with inflammatory bowel disease. What do you tell them to do or not do?
Maybe we should just define what we're talking about first.
Okay.
Because inflammatory bowel disease, which is, there's two types, ulcerative colitis and Crohn's disease, is inflammation of the gut, usually to the point of pain and bleeding. And it's an autoimmune disease. It's an autoimmune disease like lupus or psoriasis or rheumatoid arthritis or scleroderma, where your immune system attacks the lining of the bowel and destroys it. And so we're talking about a disease that's not only of the bowel. The immune system is the whole body. It comes from the bone marrow. It comes from your cells. Your cells see some part of the body as foreign and attacks it and inflames it. So the inflammation, even though manifests itself in lupus, let's say with skin disease or with kidney failure, and in inflammatory bowel disease, the attack manifests itself with bleeding and inflammation and diarrhea and indigestion because the bowel's being attacked. So it's a type of autoimmune disease. That's inflammatory bowel disease, IBD, inflammatory bowel disease, IBD. Then there's irritable bowel syndrome, IBS. And that's not an autoimmune disease. That's when you just have when you're not digesting food well, and you have bloating and gas and stomach pain and indigestion and alternating constipation and diarrhea. It's not as severe as inflammatory bowel disease because it's not associated with bleeding and destruction to the lining of the gut. Because Crohn's disease is usually higher up, whereas ulcerative colitis is mostly the colon, and Crohn's disease is when it can cover your small intestines and be severe enough to cause scarring and strictures and obstructions, where people actually need surgery to heal parts of the bowel that have been so permanently damaged. So what you had is more serious, the inflammatory bowel disease. And since it's a form of autoimmune disease, not a bowel disorder, we can't just treat it from the bowel itself. We have to, because it represents a person's overall health that they develop an autoimmune disease. So my protocols for reversing autoimmune disease are similar from lupus to psoriasis to rheumatoid arthritis to inflammatory bowel disease. They're relatively similar in building and strengthening the immune system and trying to normalize the immune system. And in general, disease has an common cause. All diseases have a common cause, and that is lack of nutrient density in the cells of the body and enhanced exposure and concentration of toxins in the body. Could be chemical toxins that are exogenous from the outside world, smoke, chemicals, pollutants, plastics, but it's often toxins the own body produces, like metabolic wastes, like aldehydes and formaldehyde, and reactive oxygen species, too many free radicals, and advanced glycation end products. But it's usually urea and there's a lot of toxins. So in our cells, in our body, we have a mixture of the endogenous toxins produced by the body itself and the exogenous toxins coming from the outside world that the body can't clean itself and repair itself with so much waste products. And the body's cells become abnormal. And then the immune system recognizes the surface of the cell as being abnormal, even though it doesn't have cancer, it's not dead, and the immune system responds overly reactive, responds to it and attacks its own body. So yes, so all those things come together, including the tendency of the body to become more inflamed when you have omega-3 deficiencies as well, contribute to the pro-inflammatory state of the body and the immune system. The problem with what makes inflammatory bowel disease so difficult to treat is that we're trying to nourish the body with nutrients. we're trying to fix the immune system by getting these high nutrient foods into the body, but the body can't digest things, and we feed them foods, it's going to cause diarrhea and bleeding and indigestion. So sometimes we have to be very delicate and very careful with what foods we're feeding the body while we're gradually building the body's strength in their immune system strength built on phytochemicals and nutrients, and of course detoxifying the body. And the methodology I use to get people to help people with diseases involves some type of fasting, whether it's water fasting or juice fasting or giving special diets with only cooked foods like zucchini, like a zucchini diet or something. So sometimes we have to rest the bowel so we can get nutrients into the body again. So whatever, I don't know much about your particular case and what made you better, but I know about the hundreds of people that I've treated with this condition and the difficulties they've had. And each person is different, because you may have done better on a mango diet, whatever you did, it doesn't mean that would work for somebody else. In most of these cases where they have severe inflammatory bowel disease, and some of them have 15 bloody bowel movements a day. Like, for example, one guy was a patient of mine. He worked as a person in construction as a builder, and he traveled around in a van, and he had a portable toilet in his van because he had to go all the time. And it got so bad that he had to be hospitalized because his bowels were bleeding so bad, and they put him in the hospital on IV steroids and no food, just liquids and IV fluid and steroids to stop the bleeding. And he was visited by all the surgeons and doctors in the hospital who told him he needed to have his colon removed and put a bag there, remove his colon because it was too severe to be fixed at this point. He had tried all the drugs. They slowed the bleeding down with the steroids, but they didn't see that he would be able to be sustained long term on the steroids. So I actually took him home from the hospital, right from the hospital into my house. And I had him live in my house for a month, right out of the hospital, so I could continue to slowly refeed him and heal his gut. So in this case, I'm describing a case that needed delicate care and take him from a fasting state on steroids to be able to get the steroids out of his system, continuing his fasting state until I could get him more stable. And also rest the bowel so it was not bleeding. And then we fed him, a mush made out of mostly cooked zucchini. And then after a week of eating, adding some other cooked mushy vegetables to that, then we started adding things like a little mashed potato in that. You know what I mean? So we gradually built him back to be able to take, and then to be able to take some raw juices. That we could add raw vegetable juices. The caveat here is I did not feed him salad and raw fruit at the beginning. I could not give him. It wouldn't have been through our experience of taking care of people like this. If they're bleeding, we can't feed them raw food at the beginning, and they're better off with things that are cooked and easier to digest and pureed and get to build up the nutrients more slowly. But a person who's controlled with their inflammatory bowel disease, who's not bleeding and who's not active, we can start to give them raw foods and chewing them real well and giving them soups and right at the beginning to get their body built back again,
Yeah, well, it's a lot of things you said there, and it's a terrible disease, but the body reacts so quickly to it that when it's healing, how it's working based on, like you said, is the bleeding stopping? How many cramps are they getting throughout the day, and how many bowel movements are they getting? So you start to see the improvement like right away. Unlike some other things, you gotta give it some time. This way you get to know, and I'm full agreement with you. You wouldn't want to give somebody an inflammatory attack, the roughage that comes in salad greens. It's not a good idea. So a couple of questions come to mind. So people are so sensitive at that point when they're in the middle of an inflammatory attack. Would you ever suggest somebody, because the steroids usually work in of course there's side effects, but it usually stops the bleeding and slows down the inflammation. And in certain cases, when people don't have the patience to do it with the way you would recommend it, would you ever recommend them, look, take the steroids, get out of this attack, and then we'll help you get rid of the steroid poisons and so on? Or do you go by people's like patients and things like that? Would that ever seem like a possibility or something?
Yeah, yes, you're making another good point because each case is individual. Like we can't give talking about this type of disease is a serious problem. We can't give one way of treating everybody. The cases that are just starting out, we don't have to put them on drugs. We could start them out with some episodic fasting and some get them to rest their bowel and use nutritional protocols and get them well with no medications even. But some cases that are so advanced and in condition, and they're not in good, their condition is so fragile that we can't, that we need to use some medications to stabilize them first. And sometimes IV fluids. I've had people who had inflammatory bowel disease, who we started to give them bowel rest, and they started to develop vomiting and dehydration. They needed to put an IV in to give them electrolytes. You know what I mean? So each case is different, of course. And some people, but the bottom line is that when people start getting digestive problem, instead of waiting till it gets so bad where you'd have to go on steroids or be hospitalized, you Remicade or some kind of immunosuppressant like that that's so severe that can cause cancer. We want to get them started on this right program early enough in their bowel complaints that they don't get to the point where their disease gets that severe, because autoimmune diseases are reversible and people can recover from them. And as you know, I've had a woman on the National Renal Transplant list waiting for a new kidney with lupus, who made a complete recovery off all medication, kidney back to normal, never needed a transplant. And this man I'm talking about never needed his colon taken out. He regained the use of his colon and be able to back to a functional life again. And I've had so many people but some people with Crohn's disease, which is the form that attacks higher up, some of them have done very well and control their Crohn's long term, and they're still fasting right now. In other words, some of them fast 2 or 3 days every 6 weeks. And with the right diet, it seems to keep the inflammation gone by them giving themselves some bowel rest, 2 days a month, 3 days every 6 months. They still episodically do some fasting along the way as they're following the right program. Some don't need to do that. So we divide. So in other words, the protocol is very individual. This is a disease where you need individual attention to devise a protocol that works for you. So we work with the people, figuring out what works best for them. And you can see they're feeling better, they're digesting better, it keeps them in good tone, they wind up. And there are also some people who've had a history of Crohn's where they've had so much scarring and surgeries, where they have strictures, or they have some problems where they are not going to be able to have total normal digestive experience. Because they still have chronic problems in their bowel from damage to their gut that can't be fixed nutritionally. They would need surgery to take the scars out.